Audio. Good afternoon, everybody. I am Dr. Usha BR, consultant gynecologist, laparoscopy and robotic surgeon at Fortis Hospital, Bannerghatta Road. Today, I will be talking to you about the role of robotic surgery in gynecology. Robotics has been there from a few years in the field of gynecology, and we will see what are the applications of it in the routinely done gynecological surgeries. Now, when you hear the word robo, so this robo is not a machine. It is not that there is a machine which is standing and operating on patients. It is we surgeons who are operating, but it is an information system with arms in between the two of us. Like, to clarify it a little more, it is my wrist motions at the controls which get transformed into the robotic arm movements, which in turn happen in the patient's body. Did I confuse you guys? No, I will make it more clearer with pictures later on. So let's see how it all started. So in 1988, there was a robo called Puma 560, which was first used to place a needle in the brain. That was to do a biopsy using CT guidance. Later on in 1987, we had robotics, which was used first for laparoscopic surgery. And later on, 1992, the Probot, which was developed at Imperial College of London, it was first used to perform prosthetic surgeries. Later on came the Robodoc, which was introduced in 1992 for hip replacements, and then came in the Da Vinci surgical system in 2000. Later on, the 𝐔𝐬𝐡𝐚 in 2001 and new arm in 2010. Now, what we're using at Fortis Hospital is the latest version of the Da Vinci robotic system. Now, it's a robo-assisted operating theatre that we are using. Now, the robotic arms are placed into the patient's abdomen under supervision, and then the surgeon sits at the console where his wrist movements at the controls are transmitted into the robotic arm movements. And in turn, the robotic arms which are placed inside the patient's abdomen operate. So it is slightly automated, if you would say that way. A lot of preparation is required before surgery. The robo cannot make these adjustments. We will have to do the adjustments, and the entire thing is completely supervised. What are the parts of this robo? As you can see here, now the right half of the screen shows the three parts of the robo. Now you have a surgical console here. This is where the surgeon sits and operates. He has all the master controls in his fingertips and the feet. So movements at his fingertips and the feet will guide these arms to move in the patient's abdomen. Now these are the robotic arms. As you can see, they go into the patient's abdomen, and the movements of these arms are guided by the surgeon. And then comes the patient side cart, which has a monitor and all the equipment. Now coming to surgeon's console, now this is actually to improvise on the ergonomics. See, laparoscopy we've been doing for decades now. And most of the surgeries in gynecology are being done laparoscopically these days. Now, one major drawback with laparoscopy that we see as surgeons is it's not all that friendly ergonomically. So, for a person who has to stand and operate for long hours, it is quite tiresome to the eyes, to the shoulders, to the knees and lower limbs as well. So now this surgeon's console improves on the ergonomics for the surgeon. So how it happens is, one is there is optimal hand-eye alignment, And what the surgeon sees in the console is a 3D view. It's a stereoscopic view that you see, and the surgeon is comfortably seated and then operating. So even long hours of surgery would not stress out the surgeon or would not make him fatigued. So that would not affect the surgical outcomes. And then the motion scaling, especially, you see that your hands develop tremors if you're operating for a long hours, maybe see 2 hours, 3 hours, or sometimes surgeries go up to 6 hours, 7 hours. In the sixth or the seventh hour, you see that your fingers are developing, tremors. Now you're sitting and operating here, so your movements and the tremors and the faults that can happen, which are human errors, are ready. Now, what you see at the surgeon's console are master controls like this, what you see in the left half of the image. Now, the surgeon holds this and moves it like a joystick. Okay, however, he wants to hold the instrument, he holds it, grasps it, twists it, turns it, and all. Okay, so the same movements get transformed or get transmitted to the robotic arms, and the robotic arms move in the same way. If it has to be moved to the left, they move left. If it has to be moved to the right, they move right, like that. So he is getting all the master controls at the surgeon's console itself, and he is operating with a 3D stereoscopic view. It's a high definition monitor. Then coming to patient side, these are all the instrument arms. These are the arms which go into the abdomen. I mean, of course, not the arm, but then the instrument which is attached to the arm, the which are along the lines of the laparoscopic instruments, they go into the arm. See, and these instruments have endo-wrist-like movements. In fact, they have a range of motion which is more than our wrist joint that we normally have. So, and usually we attach about 4 robotic arms, in which one of them would be a camera port, and the other 3 would be having these instruments, which you could interchange as well. So, coming to the camera that gets used in comparison to the laparoscopic camera, now this has 2 lenses in it, so it gives the stereoscopic view like you see with your 2 eyes. So you have 2 different lenses, and those images are configured onto a single image. So it's a fiber optic instrument, and that is inserted through a 12 port, small incision, and the surgeon gets a magnified 3D view. Now that magnification and the 3D view is very important to access spaces, especially deep within pelvis. And it also gets projected onto a television screen as well. I'll talk about this magnification a little later. Now, what are the surgeries that we can do with robotics? All the surgeries that we are doing routinely with laparoscopy these days can be done robotically as well. But what are the distinct advantages of robotics? And so in which surgeries would you apply it more? Then this is the list. So most importantly, in total laparoscopic hysterectomy or removal of uterus, not the routine ones, the complicated hysterectomies or where we anticipate a lot of adhesions. Now, the adhesions is where you have organs being stuck to each other within the abdomen. What are the organs? Now, you can have bladder sometimes being adherent to uterus, bowel being adherent to uterus, okay, previous multiple surgeries being done, especially fibroid removals or surgeries for other reasons inside the tummy, will all cause these adhesions to happen. And then if you're attempting to do another surgery on such a patient which is high risk for injuries, so then in such case you can adopt robotics. Why? Because of the precision involved in the surgery. Now, the next most important application of robotics in gynecology is tuboplasty. Now, we have a lot of requests for patients coming in after a family planning procedure wanting to have another kid. Sometimes, in a hurry, they get the family planning surgery done and they will want a reversal of it a little later. They realize, okay, maybe they've lost a child or they won't have another kid or they get remarried, they want to have another kid. So then these patients come to us for the reversal of family planning operation. What happens in a family planning operation? The tubes are blocked or the tubes are cut and kept aside. right? So now those cut ends of the tubes have to be joined and made into a patent tube. Now that procedure can be done by an open method, can be done by laparoscopy, but with more precision in robotics. Why? Because these are small thin tubes, just about 5 in size. The thickness or the outer diameter is about 5 to 6 only in most of the length. Of course, the lateral end would be a little bigger in the tube, but then most of the length of the tube is just 5 to 6 Now, if you have to join two cut ends of a tube which is as small as 5 to 6 you need a lot of precision as to how you will place the sutures, how the tubes get aligned to have better success rate. Now, when you're thinking about precision in surgery, robotics should be the answer. You should go for robotic surgery only. Now, there are other surgeries where, we remove fibroids and we're looking at, suturing in multiple layers with precision, with a lot of hemostasis to happen. In those cases, also robotics can be applied. And another very, very important application of robotics is in endometriosis. Endometriosis is a very dirty disease, actually, and it is known to trouble a lot of young girls these days. And it is one such disease which invariably develops adhesions, and it is a recurrent disease to add on to the burden. So, a patient undergoing a surgery today is prone to develop the endometriosis again. Now, the endometriosis risk of recurrence can be there till she attains menopause. Now, it's a disease with which you have to live with. Okay, of course, you can keep it under control with medical measures, but then, yeah, when it doesn't respond to medical measures or when the symptoms are very bad, what are the symptoms? Like you have severe pain abdomen, pain during menses, or you're not able to conceive. In those cases, you have to get operated. But when it is surgery for endometriosis, you should always think of robotics. I'll tell you why. See, now endometriosis is mostly a pelvic disease. Now, when it comes to pelvis is I'm talking about the bony pelvis below the level of the pubic bone. Okay, that is where your uterus is. Now, that is an area which is a little difficult to be accessed through open surgeries or through laparoscopy also, especially when you're looking at, safeguarding the surrounding structures. Endometriosis is a disease known to affect ovaries, uterus, the peritoneum inside the abdomen. Okay, and it is known to affect bladder, it is known to affect bowel, it is known to affect ureter, almost all organs inside the abdomen. So, when it is known to affect multi organs, they are also prone to develop adhesions or they get stuck to each other. When they're stuck to each other, when you're doing a surgery, there are more chances that you could injure them. You could have a ureteric injury, or you could have bladder injury, could have bowel injury. All these are anticipated complications with endometriosis. What happens with robotics is that you get a magnified view of the entire abdomen, and your movements with the robotic arms can be so precise that you could avoid injury to the surrounding structures. And at the same time, you remove what is essential to be removed only and not the surrounding structures. Okay, especially when it comes to fertility sparing surgery. Now, when a fertility of the woman is to be preserved, we look at, uh, the cortex preservation in the ovary. We look at, preserving the ovary to the maximum. Okay, so in such cases, when you're looking at, fertility sparing surgeries, like for example, you have a young lady who's developed endometriotic cyst. She's still not conceived. Now, first surgery usually in endometriosis happens very easily. But if she's somebody prone for endometriosis again and again, and this is a second or third surgery, you usually see it being stuck everywhere. And in such cases, if I keep peeling off the cyst wall, then I'll end up removing the whole ovary. But in robotics, because of the magnified view, I will remove the cyst wall very carefully and I will leave behind the normal ovary. In endometriosis, the main treatment is complete excision. So, the more you excise, the better is the clearance, or the better is the symptom improvement for the patients. At the same time, you should not remove what is not to be removed. Correct? So, that would mean fertility sparing for the patient. So, When you're thinking about precision in surgery, finesse in surgery, you should always think about robotics. And again, in cancer surgeries, we all know that when it comes to cancer surgeries, optimal removal of the tumor mass is very essential for the patient to recover. If you have not done optimal surgery, optimal debulking of the mass, if you've left behind the mass, then there are more chances of recurrence for the patient. So in such cases, identifying what the tumor extent is, removal of the tumor completely, along with the lymph nodes, and without damaging the surrounding structures. That is very, very essential in tumor surgeries or cancer surgeries. So, for those surgeries as well, especially when it comes to radical hysterectomies or surgeries where we are doing deep in the pelvis, okay, the what is that? The instrument movement that is allowed with the robotic arms enables us to do a complete clearance. Okay, in that way, robotics has a lot of role in the routine gynecological surgeries that we do. So if you see what is the difference, see a lot of them get operated by open surgeries also. Now you see in the second image here that there's a big cut here that the lady has because of the conventional surgery. It could be a horizontal cut here or a vertical long cut also. That is the open surgery. This is almost 10 centimeters long. And you see with the robotics, we have just 3 or 4 incisions that we make, and these are all 12 mm and 8 mm incisions. Okay, so obviously, cosmetically, these incisions are much better. And pain wise, you can compare yourself having a cut of just 1 centimeter and 10 centimeter. Obviously, 1 centimeter cut would cause less pain, right? So, because of less pain, you recover faster. Now, coming to advantages, extending on that, what it means to surgeon is that surgeon controls movements of the sophisticated instrument sitting at the console, which is much more advanced than the laparoscopic surgery. So you can do all the complex procedures. See, we are not talking about robotics for the routine cystectomies, diagnostic laparoscopies. No, we're talking about robotics and its application for complicated surgeries, complicated cases where it is we are anticipating adhesions, where we are anticipating injuries to surrounding organs, or we are anticipating or we are wanting more or optimal tumor clearance. So that is the main application of robotics in gynecology. Now such complicated procedures can be done with ease and stability and precision, so you will have better reach to the deeper areas. So because you're able to access deeper areas better, there are lesser chances to conversion of to open surgery. Many times what happens when you're doing laparoscopic surgery, we find that, oh, this area is not accessible, no, I'm not able to do a good adhesiolysis, organs are stuck. When I feel the surgery is not going to be safer, I will convert it to laparotomy. Okay, unlikely that we do it routinely, but then yeah, those chances of conversion to laparotomy is much lesser when we're doing a robotic surgery. Why the conversion rate is lesser? Because it is giving a lot of comfort to the surgeon to do the surgery. Very minimal blood loss and quicker recovery. Okay, so lesser need for antibiotics as well. So you're operating again through very small, for patient, what is the benefit? So she'll have small incisions. So there is reduced loss of healthy tissue. This is what I meant when I spoke about endometriosis. So when you're operating for endometriosis, the surgery should not be too radical to lose the normal tissue. But at the same time, it should be precise enough to lose or excise what is abnormal, because unless the abnormal endometrial tissue goes out, she will not have pain relief. Okay, so it is important that your surgery is precise. So it'll have patients will have less pain, shorter hospital stay, and reduced cost, in the sense that it is more cost effective because you're getting back to work sooner. So greater surgical precision and lesser blood loss during surgery, so lesser incidence of transfusions. What about its effect to the society? For the patient, it is less pain, no scar, so you're getting back to normal earlier. It works like magic, actually. So no long time antibiotics or no side effects of antibiotics. For the family, there's no need to take leave from work. I mean, most of them are up and about the same day or maximum for a day. So less requirement of help, and then you're getting back to life early. Now, of course, so that means to say robotics has no disadvantages? No, there are a few. What are the disadvantages? Is that, of course, we've been using robotics as well now for more than a decade right now, or even more. But then the question of safety needs to be assessed over the long run. Okay, so I'm operating at the console, the movements are getting transmitted, but of course, there is someone to supervise, okay, the whole thing. And the success of surgery again depends on the skill of physician itself, because the entire control is in my hands. It's not only the equipment. Of course, there is a little bit of maintenance cost, which comes out to be high at the end of the day, and the initial cost as well for the robot. So that was about robotics and its application in gynecology. Thank you for all your patient listening. Any questions, I'll be happy to take. Okay, we have a question coming up. How is it possible telescopically? How many teams of surgeons and other specialties are required to run a facility at tertiary health center? I think you're talking about telemedicine, if I'm not wrong. Okay, now there is a concept that you can actually operate on a patient sitting at a distance and all that. So that probably will come in once your internet networks and all improve and it is compatible with the whole thing. So that is something which we're looking at in the future. Okay, thank you all for your patient hearing. Have a good day.